Hello, welcome to the Introduction to IPUMS NHIS webinar. I'm Julia Drew, and with me I have my colleagues Natalie Del Ponte, Erin Meyer, and Joe Grover. A few quick notes on how we've structured this webinar. First, if you have any questions, please submit them to us in the Q&A. We will respond to most questions through the Q&A feature, although we may hold some for the end, questions that we think would be of broad interest. More detailed questions will get directed to our user support email at ipums@umn.edu. We have set aside the last 20 minutes or so to answer additional questions and cover some frequently asked questions. Last, this webinar is being recorded. We will post it to our website at ipums.org/support/tutorial. So if you have to leave early for any reason, you can see it later when we post it, and we'll try to get that up as soon as we can. Let's get started. So today we will familiarize users who are new to IPUMS NHIS with the National Health Interview Survey data and identify the differences between the original National Health Interview Survey data that is collected by the National Center for Health Statistics and the IPUMS version of the data. We will then take you through a guided tour of the IPUMS NHIS website. During the tour, we will highlight helpful resources and key features of our documentation, demonstrate how to make a customized extract of the NHIS data from our website, and point out cool features that you might not know about. Last, we will end with a Q&A session. For those of you who are just joining us, please submit any questions you have for us using the Q&A feature. We are recording this webinar and we will post it to ipums.org/support/tutorials. So what is IPUMS NHIS? It is a collection of harmonized data from the National Health Interview Survey, or NHIS. The NHIS has been collected by the National Center for Health Statistics since 1957. Making it the longest running annual health survey in the world. You can access the original files at cdc.gov/NCHS/NHIS. The NHIS is collected through in-person interviews by trained census interviewers who gather information about health and the correlates of health for all household members. It contains a comprehensive set of measures of health and health conditions, health insurance coverage, healthcare access and utilization, and health behaviors. It also captures a rich array of social and demographic characteristics such as race, citizenship, nativity, sexual orientation, education, occupation, and marital status. The NHIS is designed to be representative of the non-institutionalized civilian US population. It cannot be used to study nursing home residents, active duty members of the military, or incarcerated persons. Although the NHIS has been collected since 1957, only the 1963 and later samples have been preserved and digitized. Each year, data are collected for somewhere between 30 and 50,000 households and between 75 and 100,000 people. The way that the NHIS data has been collected has changed over time, and the format I'm about to describe covers the NHIS data collection approach, beginning with the 1997 sample and continuing through the most recent data available, which is the 2018 sample. The NHIS is effectively a sample of households, and each sampled household can potentially contain multiple families. This is true for a minority of households. Most households only have one family. There is one person for each family, the family respondent, who answers a set of questions about demographic characteristics, some socioeconomic characteristics like education and family income, certain measures of health status and chronic conditions, health insurance, and injuries. All persons included in the NHIS sample will have information on these measures provided by the family respondent. In addition to the questions answered by the family respondent, there are additional questions asked of one randomly selected sample adult and one randomly selected sample child per family. The sample adult is a person providing information for themselves on the sample adult questionnaire, unless they are unable to do so for physical or mental reasons. In this case, the sample adult's information is provided by a proxy. An adult residing in the household who is knowledgeable about the sample child's health provides information for the sample child questionnaire. Variables on BMI, mental health, certain measures of access to care and health behaviors, and for sample adults only, sexual orientation and job information are derived from information collected on the sample adult and sample child questionnaires. Most, but not all supplemental questions, for example, the cancer screening and control supplements or the complementary and alternative medicine supplement, are also only asked of sample adults and or sample children. I will pause here to note that starting in 2019, the way that NHIS data are being collected has changed. The primary change is that going forward, the NHIS will only contain information about the sample adult and the sample child, and aside from some basic household roster information, will no longer collect information about all household members. That being said, there will be several measures of family characteristics provided for the sample adult and sample child. In addition, there will only be one sample adult and one sample child selected per household rather than per family. Because the data haven't been released yet, we don't have full information about the 2019 redesign. However, if you have questions about the 2019 redesign, we are happy to share what we know during the Q&A at the end. What does IPUMS NHIS offer that is different than the public use NHIS data and documentation available directly from the National Center for Health Statistics? IPUMS provides a version of the NHIS data that is harmonized, integrated, and customizable. The National Center for Health Statistics has been collecting the NHIS for more than 60 years. Understandably, there's been quite a bit of change over time in which questions are asked, how questions are asked, what variables are included in the data, and the response codes for each variable. We make it significantly easier to use the NHIS to study change over time or use several years of data pooled together for a bigger sample size. IPUMS creates variables that are comparable over time, a process also known as harmonization. We assign variables the same name over time and impose a consistent coding scheme without losing detail. A variable with a lot of change over time, for example, is race. In 1963, the first year we have the NHIS data, race has 3 categories: white, black, and other. In 1995, the number of categories for the race variable expanded to 18 different categories, including separate codes for groups such as Aleut, Vietnamese, and Samoan. By 2018, the number of categories for the race variable has been reduced to 8: white, black or African American, American Indian or Alaska Native, Asian Indian, Chinese, Filipino, other Asian, primary race not releasable, multiple race, and no primary race selected. You may also notice that the same numeric codes hold different meanings in different years. The number 9 is associated with Korean in 1995 and Asian Indian in 2018. And the number 11 is associated with Japanese in 1995 and Filipino in 2018. Also note that in 1995, there is a code for 99, which is associated with the unknown meaning, but there is no comparable code in either 1963 or in 2018. Unknown values were not allowed in those years and either filled in by the interviewer's best guess of the person's race or in later years by imputation. We release a single variable called race A that has codes that are comparable between 1963, 1995, and 2018, and all samples in between, so that common values are coded the same way across all samples. We enable users to retain all of the detail using the detailed codes in the first column. but also make it easy to aggregate values for users who wish to compare a long time series using just the first digit of the detailed codes represented in the second column, the general codes. Each variable has its own web page on the IPUMS NHIS website, including a description of the variable, how the variable is coded, what years the variable is available, an explainer of whether and how the variable has changed over time, the original questionnaire text used to collect the variable for each year it is available, the appropriate sampling weight to use for each variable for each year, because sometimes it changes, and the name given to the variable in the original NHIS data file. That's a lot of information. During our tour of the website, I will point out these features again. Another difference between using the original NHIS data and the IPUMS NHIS data is that we allow you to download only the variables and samples you choose. You can also modify the structure of the data within our extract system, something I will cover more later, and you can request data sets that are already formatted in SAS, Stata, and SPSS data sets. Last, we also offer additional variables and other features that we build that are not available in the original data. So what can you do with IPUMS NHIS? The IPUMS NHIS website has been live since late 2006, and we've had the privilege of seeing some very exciting research using the data. I'll give you just a few recent examples. In this 2019 paper published in the journal Health Economics, Goldberstein, Gonzalez, and Mira use measures of child and adolescent mental health outcomes and use of special education services for emotional problems from 13 years of the NHIS data to answer the question of how economic downturns affect the mental health of children. And in this 2018 paper published in the Quarterly Journal of Economics, Alsan and Wanamaker use measures of healthcare seeking behavior by race in the NHIS data from before and after 1972, when it was publicized that there had been an ongoing study of untreated syphilis progression in Black men living in Tuskegee, Alabama. They wanted to investigate the impact of the public disclosure of the Tuskegee study on the healthcare seeking behavior and health outcomes, including mortality, of Black men. For the purposes of this webinar, we analyzed data from the 1997 to 2018 NHIS to estimate the percentage of children under age 18 who were uninsured at the time of the survey by the nativity and Hispanic ethnicity of their parents. In this chart, the orange line represents the percent of children who are uninsured among those living with at least one Hispanic ethnicity foreign-born parent. The gray line represents the percent of children who are uninsured among those living with at least one foreign-born parent who is not Hispanic. And the black line represents the percent of children who are uninsured among those living with only native-born parents. The chart shows that the share of children who are uninsured dropped dramatically for all three groups, but it also reveals important between-group differences in the share of children that are uninsured. Next, I will show you how to create a customized extract of the IPUMS NHIS data that was used to create this chart. Before I do that, however, I'd like to pause and remind anyone who just joined us to submit any questions they want us to answer using the Q&A feature. Additionally, this webinar is being recorded and will be posted to ipums.org/support/tutorials. This is the homepage for the IPUMS NHIS website, nhis.ipums.org. I'm going to switch to full screen view, but this is the URL I'm starting from, nhis.ipums.org. If you look under documentation on the left-hand side menu, and the third item, user notes, you'll find a number of handy web pages drafted by our staff to get you started with IPUMS NHIS, learn how to appropriately weight the data, and provide in-depth explainers on special topics. This is a great set of resources. I recommend browsing if you haven't done so already. If you scroll to the last set of links on the left-hand menu, Contact Us, You'll find a variety of ways to get help from us. Under Help, you can find a link to online tutorials and data training exercises. You can also visit the user forum to view questions that other users have already asked and have had answered, or pose a question yourself. Or you can email your questions to our dedicated user support team at ipums@umn.edu. Scrolling back up, if you look at the middle of your page, you'll see two boxes prominently featured: create an extract and use our online tool for analysis. This is how you access our online analysis tool, which is called SDA. We won't cover that in today's webinar, but know that on our website at ipums.org/support, we do have tutorials on how to use SDA. I'm going to create an extract for you in today's webinar, and so I will click Get Data. Clicking Get Data brings you to a new page with several ways of interacting with our website to figure out what variables and years are available and to customize the data set you end up creating for download. Moving from left to right, at the very left, there is a button you can click for Select Samples, followed by a set of drop-down menus under the Select Variables heading. The variables are organized into topical groupings based on whether they are household level, person level, or injury level, or you can browse variables alphabetically. You can also click on the search button to use keywords to find variables that you're interested in. To the right of the Select Variables drop-down menus, there's a button for Change Data Structure and another one for Display Options. I'm going to leave the data structure and display options at the default for the purposes of this webinar, but know that with the click of a button, you could change the structure of the data set that you're requesting from us, or you can change the way that you view the available information using the display options button. I know that I want health insurance, Hispanic ethnicity, and whether or not someone was born in the United States for my analysis. These are all person-level variables that would be located under the person drop-down, and they're located under demographic and ethnicity/nativity. You can also use this drop-down to browse what other topics are available through NHIS. A lot of people use our mortality data. That's a very popular supplement or feature of the data. A lot of people also use health insurance. So returning to demographic, ethnicity/nativity. Clicking on ethnicity/nativity brought me to this page, which is a list of all of the variables that are included in the ethnicity/nativity topical grouping. Here's a list of the variable names that are hyperlinked. So if I clicked on them, I would go to that variable specific web page. A brief description of what that variable means. And over here to the right is what we call the availability grid. It's organized from most recent year of data, which is 2018. And if I scroll all the way to the right to earliest year of data, 1963. These X's mean that the variable is available for that year, and the dots mean that the variable is not available in that year. Over here on the left, notice that each variable has a plus sign next to it. This is how I can add variables to my data cart, which is represented up here at the top right-hand corner of the website. Notice that I've got 0 variables and 0 samples in my data cart right now. I know that I want Hispanic ethnicity. I'll go ahead and add that to my cart. But if I decided that I didn't want that variable in my cart, I clicked one by accident, or it wasn't what I thought it was, I can easily remove this variable from my cart by checking that, deselecting the checkbox. I do want that, so I'm going to re-add it, and notice that as I add it, the number of variables in my data cart iterates up by 1. I also want an indicator of whether or not someone was born in the United States. Here it is, US born, and I want to learn a little bit more about this variable, so I'm going to click US born. And this is the variable specific page for US born. It's got a number of section headers, tabs across the top that organize information that we've provided for the variable and compiled in one place. So we've got the codes page, which is what we've landed on by default, the description tab, comparability, universe, availability, survey text, weights, and NHIS sources. On the codes page, you get a bird's eye view of how this variable that you would download from IPUMS is coded. So a 10 means no, 11 means no, born in US territory, 12 means no, born outside US and US territories, 20 means yes, born in US state or DC, and then you've got a set of missing data codes from 97 and on. I can also look at what codes are available in what year by scanning this code availability grid. And visually, it's easy to identify that there was a change that occurred between 2002 and 2001. It appears that what happened was that this used to be a dichotomous variable where individuals would indicate no, not born in US, or yes, born in US. And then in 2002, that no category was disaggregated into no born in US territory and no born outside US and US territories. So it's very easy to identify changes that occur over time. The default is the category availability view, but if you use these radio buttons above the codes table, you can click case count view, and it will give you the number of persons in that sample giving that response. So for example, in 2018, you have 462 people who said no, born in US territory, 10,322 who said no, born outside US and US territories, and 61,777 who said that yes, they were born in US state or DC. On the description tab, we'll find an explanation of what this variable means alongside what we've considered pertinent information. For example, this tells you how the information was collected. To collect this information, interviewers asked, where were you born? Under the comparability tab, you'll see a discussion of how this variable may have changed over time. And if you read the text here, it describes what we already observed in the differences in the codes. So for 1997 to 2001, all persons born outside these areas are grouped together. Beginning in 2002, the data distinguished between persons born outside the United States but within a US territory, including Puerto Rico, Guam, and other outlying territories of the United States, and those born elsewhere outside the United States. The Universe tab lets you know for whom this information is available. So this variable is available for all persons for all years. If this changed over time, you would see the year range for which that applied. And then if this was available for a smaller subset of persons, for example, the sample adult or the sample child, instead of all persons, this would say sample child, sample adult, sample person, something like that. Under the availability tab, we see a summary range of the years for which this variable is available. Under the survey text tab, we give you the linked questionnaire text from the original questionnaire documentation provided by NCHS. So in 2018, you can see that in the questionnaire, people were asked, were you born in the United States? And the response categories were yes, no, refused, and don't know. Contrast this to what was asked of respondents in 1997. In what country were you or was so-and-so born? And then they actually give information about what country they were born in. So this changed from a measure where they actually did collect information about where someone was born to a dichotomous yes-no measure. And then you can also jump into the survey text here to see what the surrounding questions were asked. So this question was asked right after this question about how much a family spent on medical care, including dental care. So it's nice to get some context. Okay. And for those of you who are just joining us, we are at nhis.ipums.org, and we've selected this variable, US born. So I know that I want this variable in my analysis. I can add it to my cart here, as well as from the original list of variables in the ethnicity/nativity topical grouping page. So I'm going to add that to my cart. Now I've got 2 variables in my cart. I also know that I want health insurance. I can return to the select data page by going to select data. And health insurance is also a person level variable. So I'll return to the person dropdown, navigate to health insurance and general coverage. And the very first variable is the one that I want, health insurance coverage status, yes or no. And I will add that to my cart. Now I have 3 variables and 0 samples. I know that I want the years 1997 to 2018, so I'll go ahead and I'll select those samples. You'll see 2 columns representing all of the years of data that we have available. And these, you can add a data set individually, you can add them, add a whole decade at once, or in cases where there was a big sample design where we know a lot of users would want to start with that year and include all years available, we do something like add 1997 forward, or you can add all samples. I just want 1997 forward because that's when the variables that I'm interested in are available. I'm also going to pause here to note that if you are looking to see if we have variables on a specific topic, you may be overwhelmed by the sheer number of variables we have available. We have over 18,000 variables on our website, and clicking the samples that you want, if you know that you are only interested in a specific time range, is a really great way to filter the information that you see on our website. Once you select the years that you're interested in, only the variables available in those years will be displayed on our website. I know I want 1997 forward. I'll go ahead and submit those sample selections to add them to my data cart. And returning to the data cart view, I see that I have 3 variables and 22 samples. And that's the data I want. So I will view cart. Note that we went from 3 variables to 19 variables. Let me explain. So these are the 3 variables that I added right here at the bottom. And then there are a number of variables that may be unfamiliar to you that all say pre-selected after the variable label in square brackets. And so what this means is these are variables that we add to every extract that is made from the IPUMS NHIS website. And they're technical variables. They tend to be technical variables that you need for your analysis, but you might not think to add yourself. And so there are things like Stata and PSU that you need to appropriately adjust for the complex sample design of the NHIS. The various sampling weights. So here's the household weight, the person weight, the sample adult and sample child weight, the family weight. There are indicators for whether or not someone is a sample adult and sample child, and various linking keys in case you want to identify individuals within households or something like that. This all looks good to me. I'll create my data extract. This brings me to an extract request page. This gives me a summary of the data extract I'm about to create, and it gives me an opportunity to modify my data extract further. So I have 22 samples, 19 variables. The data format is .dat, a fixed width text file. It's a rectangularized on the person file, which means that every row in my data set represents a single person. And it's approximately 197 megabytes. If you wanted to request a data set that's already formatted as Stata, SPSS, or SAS, you would do that here on the data format row and select change. When I clicked change, it brought me to this page, data format and structure. And there are a series of radio buttons Here's the default fixed width text, but I can also use these radio buttons to select a Stata formatted data set, SPSS, SAS, or comma delimited, if whatever works for your analysis. I'm going to leave it at the default fixed width text. You can also choose to change the structure of your data here under the data structure section. And the default that we recommend is rectangular on person, but you could also choose to request a data set that is rectangularized on injury, in which every row in your data set would represent an injury, and people could have multiple injuries. You could also request a hierarchical data set where you've got households, persons nested within households, and then injuries nested within people. I'm going to leave everything at the default. I'll submit this. I also want to note the Hispanic ethnicity information and nativity information, not for the children themselves, but for the parent. If I downloaded the data set as it is right now, I would have to write code to identify children's parents, identify whether they were Hispanic or not, identify whether or not they were foreign born, and then attach those characteristics to the records of those children as new variables for my analysis. But I don't have to do that. I can actually add those variables to my children's records right here within this extract request screen. Just click attach characteristics. You can attach data from mother, father, spouse, or household head. We don't have the household head as a concept in our data set, so it's just mother, father, and spouse. I'll go ahead and attach characteristics. The attach characteristics page gives me a list of variables that I can attach as new variables to each person's record. And here is Hispanic ethnicity and US born. I want to add those for children's fathers and mothers. I just click those 4 boxes, hit submit, and notice that the number of variables in my cart increased from 19 to 27. If I show the variables in my cart, I now have this set of variables with an underscore mom or pop. And so here's Hispanic ethnicity underscore mom for mother, mom2 for for children or for households where there are 2 mothers in a same-sex couple. Hispanic ethnicity underscore pop for father, pop2 for fathers and for households that have 2 fathers, US born underscore mom, mom2, US born underscore pop, and pop2. And those are new variables that are just created within the extract system and that will appear in the data set that you download. So I am happy with my selection. It is now increased to 228 megabytes. And I can describe my extract here. So this is for an analysis of uninsured children by parental nativity and Hispanic ethnicity for 1997 to 2018. And then that would be all of those years of data and only those variables plus the analysis variables plus the characteristics of parents for children. I submit my extract and it prompts me to log in. If you have not yet created an account, you can do that here, create an account here, or you can do it from our main page from the left-hand menu. I already have an account, so I'm going to go ahead and log in. It brings me back to my extract request page. I don't have to reselect everything. It remembered everything, including my text description, and I'll submit extract. And it brings me to a list of all of my download extracts. So this was number 242 of the extracts that I've made from IPUMS NHIS. Notice that my data that I just created is still processing. There are a number of command files available, SPSS, SAS, Stata, or if you're an R user, you can use our package IPUMS R to create a data frame using the DDI. If I had requested a formatted data set, it would appear here, and none of these command files or this data here under fixed width text files would have appeared, and there is my text description. I realize that I have no way of identifying all children in my extract because I forgot to add age. So I am actually going to return to my extract to revise it and add age. You can go here to my extract request page, change. I know that age is a person level variable, demographic and core demographic. I'll add age to my cart, view my cart again. And there it is, age, I've added it. Create data extract. And now I've got a revision of it. It populates this automatically. So we do have sometimes revision of, if you forget variables and add them or add samples. And I can modify this further to reflect what I added. I added age, and then I submit extract. And there it is. I didn't have to wait for the old extract that I created to finish processing. I could just revise it on the fly. That was fine. And I also didn't have to go back and resubmit all of those selections again. It remembers all of the selections that I made. And in fact, we have users who have a report, a standard report that they generate where they will add the most recent year of data as an additional time point on a graph or something like that. And they'll remember their extract specifications here. And when the new year of data come out, they get the email from us letting them know that it's available on IPUMS. They'll come back here, they'll look for their extract, they'll revise it, add the most recent sample of data, and then resubmit it, and that's all they need to do. So when this is done processing, you will get an email. And in that email, there'll be a link back to this page to download the data set, and then also to download whatever command files or formatted data that you want. In that email, there will also be our recommended citation for how you cite our data in case you're using it in a research paper or report. So what do these data look like? I'm just going to escape from the full screen view and switch over to, I read these data into Stata. And this is the data set that I downloaded. It will come as a compressed data file, so you need to decompress it before you can read it into your stats package. And here, each line represents a person. These are from the 1997 data. And if you scroll all the way to the bottom, there's our 2018 data. There's all of those technical variables that we automatically added. And then if I scroll over to the right, you can see there's age, sex, race, Hispanic ethnicity, years in US, and this was from another extract that I made that had far more variables. So we have information on the number of years people spent in the United States, whether or not they were US born, and so on. And then here's some of the healthcare access measures that we have. So these are people who had to delay or forego needed medical care due to cost. Here's health insurance coverage, whether or not they have health insurance coverage. Here's whether somebody received a flu shot in the last 12 months. So we have quite a number of variables, and that's what that would look like once I get it read into my stats package. All right, with that, I'm gonna stop. We're at about 20 minutes left. I'm going to pull up a screen that tells you where you can get help. And for those of you who didn't already hear, we will post a recording of the webinar to ipums.org/support/tutorials. And then if you have a detailed question or something occurs to you after this webinar has ended, you can email us at ipums@umn.edu, and our wonderful user support staff will respond to your email. Thank you, and I'm looking forward to your questions.
Okay, we are getting some questions about the geographic unit at which the data is offered. Can you talk a little bit about the geography available through IPUMS NHIS and how people could conduct analysis at smaller geographic units?
Sure, so, so the question was about what level of geography is available in the public use NHIS data that we offer through IPUMS NHIS, and how people could get that information at lower levels of geography. So that's an excellent question. We get it all the time. The lowest level of geography that's available on the public use NHIS data is region. So unfortunately, you can't get state on the public data. However, you can, if you have access to an RDC, in it, and you can get access to an FSRDC, you can get access to the restricted versions of the data. And in the restricted versions of the data, there are lower levels of geography available. I can't recall off of the top of my head what level will be actually offered to you, but they will mask lower levels of geography. So for example, if you have data from a different source, let's say you have the health area resources file or something like that, or you have information from the census about neighborhoods and you want to attach that at a lower level of geography, you can work with your NCHS analyst. We have information on our website, resources to get you started on the process of requesting restricted data, but you'll really have to work mostly with NCHS to access those data.
We have a question from Ipshita. They're wondering if you could please discuss the income variables. What would be the best approach to deal with the imputed income variables in your analysis?
So if you are, okay, so I'm going to so this is an information or a question about the income data and the imputed income files. So if you're unfamiliar with the income variables and the imputed income files, there's information that is released with the core data release every year. And in that core data release, there is an income variable or a set of income variables. And there's a lot of missingness. I think approximately 20% are missing, and maybe that's increased over time. And so recognizing that income is a really important variable for lots of people's analyses, NCHS releases in a later release what we call imputed income files, and they release 5 different imputed income files per year of data. They also share code to include those imputed income files or income variables in your analysis using SAS callable Sudan. And we do have code on our website showing you how to use that, or you can point to that, or you can look for that in the original NCHS documentation. Does that get at your question?
Yes, I think that's great. Zoe is wondering if you could talk more about how to weight the variables and just what the appropriate weights are to use and when.
Okay, yes, thank you for pointing that out. I meant to emphasize that more. So for variables that are available for everybody, all persons, it's appropriate to use the person weight. However, most people want to combine information that's available for all people with information that's available for a smaller subset of people, for example, the sample child or the sample adult. In this case, it's appropriate to use the more restrictive subsample weight, so the sample weight. And the weight that you choose can have big implications for your analysis. The weight that is associated with each sample person, for example, is much larger than the weight that is associated with each person. So you may be overestimating if you use sample weights for when you should be using person weights, or underestimating if you go the other way.
Okay, another question here. What if the variable is there for multiple years, but the variable name changed at some point in time? Will there be 2 variables, or how does IPUMS approach that?
If the variable name changes over time, if the concept is comparable over time and we think that we can make the coding scheme work without losing detail, we will put those together in a single variable. However, if there's a big change over time, like we think the concept is different in a meaningful way, we will offer that as 2 different variables. Or if the coding scheme differs in a way that it would be advisable for users to just treat them as 2 separate variables.
Thank you. Hanwei is wondering if the measures of health status are based on respondents' self-reports. Is there any health measure, for example, body weight, height, or blood pressure, that is collected based on a physical examination during the in-person interview?
Great questions. So some health status measures are reported by the family respondent. So for example, the 5-point health status measure that is used in a lot of research, that can be reported by the family respondent because it's collected in the core questionnaire. Information on health status that's collected in the sample adult questionnaire, unless the questionnaire was completed by a proxy, will be self-reported for the sample adult. I wouldn't assume that the sample child information is reported by the sample child themselves. A lot of times most times I think it's reported by someone who's knowledgeable about the health of the child. In terms of whether or not information is available for physical examination. So the Census Bureau interviewers, it's my understanding, are not allowed to touch people. So everything is self-reported. There has been some consideration of adding biomarker information to the data. So this would be something that might be like a blood prick or something like that. But it's my understanding that that's also years off. So there's nothing that's available in the data right now that's biomarker data.
Thank you. David asks if there is a brief description of the main difference in the data when it's structured as hierarchical versus the default structure, say in terms of how the rows or observations are formatted.
Yes, so if you were to open up your hierarchical data file, you would see that you would see a new field that we add, which is called rec type. And in that rec type field, you'll have H, and I think in what you download, it might actually be 1, the number 1, 2 for people, and 3 for injury, or HP and I. And so that first record would be household, and then there would be a list of all of the people who live in that household. And then under the people, there would actually be a list of all of the injuries sustained by those people. So there would be no injury records if that person didn't have any injuries, or there could be many injuries that they had sustained. So that's how that would look, versus the default, which is one record is a person and all of their household information is added as person level variables. So everybody in the same household would have the same information on those household variables, but they're still person level variables.
We have a follow-up question for the income variable.
Oh, sure.
Even at the RDC, is that variable still only available as categorical, or can you know the exact income of someone?
That's a good question. I feel like I don't know enough about the restricted versions. It is my understanding that a lot of variables have more detail and maybe are not top coded anymore, but you would really have to check with NCHS to get that information.
How should users talk about the IPUMS NHIS data in the methods sections of their papers, or how should it be cited?
Oh, good question. So we actually have a dual citation structure with the NHIS data. So if you're talking in your research methods section, you should describe the NHIS as being collected by the National Center for Health Statistics. They collect the data. They should be cited at that point. But then say that you downloaded harmonized versions of the data from the IPUMS NHIS website, and then there you should cite us.
Thank you. Janice is wondering, she noticed that there were cancer topics available in the drop-down menus. Can you tell her whether these topics represent the cancer supplements to the NHIS? And do you know the last time the NHIS issued a cancer supplement?
Yes, so most of them are the cancer supplement data. I'm not sure if there's a variable that's asked every year about whether someone has ever had cancer. And then there are a set of variables about specific types of cancer and at what age people were diagnosed with those cancers. And those are available every year. But then there are an additional set of questions that are only available in the supplements that you refer to. And there are 2 sets of those. So there's a really big cancer control supplement that's asked in every year that begins in, or that ends in 0 and 5. So the most recent one was in 2015. But then there are also, there's another cancer supplement that is asked in years that end in 3 and 8 that has a more limited set of cancer screening and prevention variables, mostly cancer screening variables. And that one was asked in 2018, so in the most recent year of data.
Okay, and when are new NHIS samples released, and how long does it take us to add them to the IPUMS website?
So the new NHIS year of data has been released at the end of June every year. So the week of June 24th is what we have on our calendar, where we're constantly checking the NCHS website. And we turn those data around in about 2 weeks. So we have historically released the data right around the 4th of July holiday, so that they're available on our website. However, there has been a change in 2019 in the way the data are collected, and I anticipate that that may slow down NHIS in terms of their release schedule, and it will probably most likely slow down our turnaround just because the variable names may have changed. We are going to be reading the documentation very closely, more closely than we usually do, to understand the changes and understand how much of the new data are comparable to the old data. So that's going to change with next year.
Thank you. Hari has a follow-up question to weights again. So if someone is using different variables with different weights, which ones should they consider for their analysis, and how do they determine which weights to apply to which variables?
So I'm assuming you're going to use you're employing a multivariable analysis. So you might be looking at something like the effect of education on health-seeking behavior, for example, and you've got age and race in your model. In that case, you would use, you would use the sampling weight that is associated with the most restrictive variable in your analysis. And what I mean by that is that there's a set of information that's available for everybody. That's that all persons designation in the universe. And then there's a set of information that's only available for somebody who completed the sample child questionnaire or the sample adult questionnaire, or perhaps one of the supplements. And that will also be identified in that availability tab. So whatever the variable is that has that that more restrictive group, the sample adult, the sample child, that's the sampling weight you should use. And just from a logistical perspective, you have to do that because everybody else who was not a sample adult or sample child will have missing values on that variable. And so they'll drop out of your analysis anyway because they're structurally missing. And so in those cases, you really want to apply the sampling weight for the sample adult or sample child, what we call samp weight. We've combined those into a single variable. And if you used per weight instead of samp weight, especially if you're generating estimates of the population counts, you can get dramatically different results.
Okay, and they're also wondering if they're pooling multiple NHIS years to increase their sample size, so the sample size or sample weights automatically account for those different years.
No. And so the sample weights that are included with each year of data are really intended to give you an estimate of the population of the civilian non-institutionalized US population in that calendar year. When you combine years of data, you're actually making inference to a range of years. And so the general advice from the National Center for Health Statistics is that when you're combining years of data, you should divide by the number of years that you've included in your pooled sample. However, that's with a big caveat. So there are changes in the sample design over time. So the last big one actually was instituted in 2016. Before that, there was another change in 2006. And before that, there was a big change in 1997. So there's other ones before that, but those are the three most recent ones. And then another one, well, yeah, so the 2016 sampling design. And so if you are pooling years that cross sample design periods, so for example, you're pooling 2005 and 2006, you're pooling 2016 with previous years of data, you should actually only divide the weights by the number of years within that sample design period. So if it's 10 years between sample design periods, you should only divide the weight for those people by 10. And then let's say you've got 2 years from the following sample design period, you should divide those by 2, because you're really inferring to the range of years that is for those years. So we have more guidance on this on our website. If you go to the left-hand side menu and go to user notes, there's one on variance estimation, and we actually address and provide sample code for cases in which you may be pooling years together to increase sample size for your analysis.
Someone is wondering if the NHIS is a repeated cross-section. Are the same people surveyed in multiple sample years?
So yes, it is a repeated cross-section, but it is not longitudinal. So it's not the same people that are interviewed. With the sample design period, they select primary sampling units in Stata based on the most recent census. And they use the same sampling units within that sample design period, but they're not interviewing the same people. And so you can only use this to cross-sectionally.
And how often do we find errors in the data that we publish, and where is that information reported?
I would say it's fairly rare that we find that errors are reported or that we find a fix. We are running data quality checks constantly on our data, and every once in a while a user will write in and let us know about something they've observed. Usually it's in the older data, and in that case we fix it. We run quality control checks, and we try to push the fixes as soon as we can to our live site, and then we document that error and what was done and the implications of that change in our errata and revisions link that's located on the left-hand menu. And then if you are a user that finds a substantial error and you report that to us, you do get a mug, which I understand is a status symbol now.
Okay, and then quick follow-up question to the sample pool for NHIS. After people are interviewed, are they dropped from the sample pool?
You know, that's a good question. I don't know. It's my understanding that they shouldn't be. They're treated as independent observations. So if somebody did end up getting sampled more than once, you wouldn't know. But that's a good question. I don't know. Okay, and that is our last question. Thank you so much for participating in this webinar on the introduction to IPUMS NHIS. Again, this is recorded, and we'll be posting it to ipums.org/support/tutorials, and you can email us with additional questions at ipums@umn.edu. Thank you.